हेलो, गुड मॉर्निंग। आज मैं जा रही हूँ एक ट्रेनिंग पे एंड दैट ट्रेनिंग इज स्पॉन्सर्ड बाय अ फ्रांस की कंपनी। बाकी मैं देखती हूँ क्या कैसे है। लेट हो रही हूँ, रास्ते में बताती हूँ और बाकी चीज़ें। बाय। ये वीडियो स्पेशली डॉक्टर्स के लिए बनाई है, आप पक्का देखना पूरी।
Good backing and FilmMed is like known since how many years?
1978. It's there.
Yeah, over 2 decades I was thinking, but it's more.
As a company,
yeah.
it is from 1978. With some
Yeah.
few patents on that.
Yeah, so I mean they have been there. It's not like a new company. They've been into the pharmaceutical range with their patented products and all. Since I hire that in my mind, I know it's like a triple hyaluronic hybrid technology, what I would like to call it. That multiple hyaluronic acid strands mixed together with minimal modification or minimal cross linkers added to it to create a very stable, cohesive मतलब कि वो वहीं रहे, वो इधर उधर फैले ना, migrate ना करे, and a very firm product which like gives you not only the I would say a lifting and a volumizing effect. So उसी में ना just depending on कितना molecular weight का चीन आप डाल रहे हो, what is
बेसिकली यहाँ हमें थोड़ा सा थ्योरी के बारे में बताया था। जिन लोगों को भी फिलर सीखना है, थ्योरी पे बहुत ज़्यादा ध्यान दें। एनाटमी, फेशियल आर्टरीज, मसल्स, किस डेप्थ में है आर्टरीज, वो बहुत अच्छे से पढ़ लें आप सब। सो थ्योरी तो ऐसे समझ भी नहीं आएगी, तो मैंने इसको थोड़ा फास्ट कर दिया है। जो प्रैक्टिकल एस्पेक्ट्स हैं वो मैंने स्लो रखे हैं ताकि आपको समझने में ईजी हो। एंड वन मोर इम्पॉर्टेंट थिंग, आप टाइप्स ऑफ फिलर बहुत अच्छे से पढ़ना कि कहाँ पे कौन सा फिलर यूज़ होता है और उसको मॉडिफाई कैसे कर सकते हैं, मसाज टेक्निक कैसे होते हैं, कहाँ इन्वर्ट करना है, कहाँ आउटवर्ट करना है, वो बहुत ज़्यादा इम्पॉर्टेंट है। मेक श्योर वो अच्छे से आए आपको। सो गाइज़, अगर आपको लग रहा है सिर्फ थ्योरी है, ऐसा बिल्कुल नहीं है। आगे देखते रहिए, आपको प्रैक्टिकल भी मिलेगा और बहुत अच्छी टिप्स भी मिलेंगी।
पता होना चाहिए दैट हाइलुरोनिक एसिड कैसे बनता है, बैक्टीरियल फर्मेंटेशन से बनता है। इवन हमारे टॉक्सिन्स भी उससे बनते हैं, ये भी बैक्टीरियल फर्मेंटेशन से। स्ट्रेप्टोकोकस इक्वाई, सो इट्स नॉन जेनेटिकली मॉडिफाइड, सो इट हैज़ टू बी नॉन GMO जेनेटिकली मॉडिफाइड, अदर than 1 million Daltons, then they have free hyaluronic as well. So they are like just combining, they just entangle. Just remember that they entangle naturally amongst themselves to create a very cohesive, firm kind of a structure, which is a stable structure. Yes, if you don't lie down and if you can keep sitting like that, will be good for us. And then when you put the numbing cream, then you can lie down. Okay. So okay, you have a patient like her walking into your clinic. What is so of course she will have her own concerns, but let's say she's that kind of a patient who says, keep doc, I just want to look good, just do whatever you want to feel like. So what is the first thing, what is the first impression that you have when you're just quickly giving her a look for first 10 seconds? Exactly. What you? Yeah. What I am feeling, the first thing, if you don't, just close your eyes, look at her, then again close your eyes. The first impression you'll have is the face is looking a little droopy and sad, right? That's the first impression, more than anything else. And then when we are looking at her, so again we divide the face into upper third, middle and lower third. I overall feel she looks really young for her age. Her features are nice, look at her brows and she's got a pretty cute face. But just little aging signs, maybe because of stress, maybe because of weight loss, anything that has just made the face a little more droopier, that just needs to be lifted up. So you have to always go with your gut feeling as well, that what is the first priority thing that will just change the appearance on your face. I think we are all on the same thing. It is this droop, right, which really is catching. Then uske baad just see what is the second priority. Once you make up things in your mind, then without saying anything, you have to ask the patient, ma'am, what are you feeling? Then just treat accordingly, that how you mutually are along that page. So the next thing, then I'm feeling her eyes are again looking tired. So it is the eyes. So this and this to my eyes is, I think these are the two most important things. And third, as doctor said, I think we can always just do this thing. Any which ways, while you do that, you by default need to do a little cheek lifting as well, right? But correcting this and correcting this, she's not having any deep nasolabials. Whatever little shadows she's having, just by giving a nice stretch here, she'll be doing well with it. So these are the two. There are two things for a patient: essentials and luxury. Essentials means the need of the hour. The need of the hour is this and this that can really refreshen up and uplift her look. The second thing, which is a luxury, what is it after correcting the basic stuff that can enhance her look, make her look even more prettier? So enhancements made, then you just look at, okay, we can do a little bit of forehead as well. We can just do a little lip correction, because the lips with aging are looking a little pursed in, flatter. They have lost the vermilion border, and her chin also is just looking just rolled up. You just need to soften up her chin. I think it's important to do a little Neuromod, Botox, Dysprosium and anything to relax her mentalis. And then while you do this, any which ways, her little pre-jal sulcus that we may just be seeing, that will also get corrected. So what I feel in luxury enhancements, you can correct her lips, which will look better. And second, you can do a little Botox or Dysport for her upper face and her mentalis. So that's what can work well. I think she's having decent volume for her body structure. I mean, it's not that she's very gaunt. Just when you're doing a little volume here, any which ways, we can just put a little thing while we do the tear trough or we do the cheek lifting and all. Just a little bolus around the mid part of the cheek and a little stretch here will just complete the look on her cheeks. So take it two things, the important ones, the lower thing, and this we do. After we do this for her, and then we kind of, you know, check with her, and then the next thing, maybe in her next visit, I mean, ideally, I'm just telling her like she's a patient walking in. We can ask her that, ma'am, ye lips or isko karne mein you look even more better. Now you've made a provisional diagnosis in your mind without just jumping on and telling her. Just give her a hand mirror, please. Hand mirror there. Ye raha. हाँ, जैसे भी comfortable हो. Okay. So, ma'am, just hold this for me. Okay, so you have to tell us now, you are the patient coming to us and we have 4 doctors. So just let us know, what is your main concern when you're looking at your face?
मेरा concern है like my face is squarish.
Squarish.
तो वो
See, the patient thinks differently than what you feel. Okay, तो
वो that is the main concern, and ये चीज़ थोड़ा सा sag हो गया.
Sag लग रही है. ये main लग रहा है.
और under eyes.
Correct. Yeah. So see, उनको यहाँ sagging ज़्यादा दिख रहा है compared to anything. So the first thing that she said, squarish. Then you have to just attend to that first. So you know that we can very well do that with a Neuromod, Botox or Dysport with a masseter. But along with that, whenever you do this, it's very important to frame her face, and you do a mentalis as well. Maybe 3 units, because बहुत buckling है. So when the chin relaxes, the overall contour will look even more nicer and heart-shaped and oval. So this and this for sure. While you are explaining her, okay, ma'am, this is what we can do, which we'll do that in, I mean, in some time, you can always say, ma'am, जब ये करना है ना, हल्का सा few drops, maybe, you know, 10-15 units if at all, you can just reserve for the forehead. This will also just freshen up the look, because आप जब से ma'am is sitting here, if you see, she is just raising her brows. Little bit is there, and this is causing some worry line kind of a thing, right? So just to relax her, because any which ways when you're doing Botox or Dysport, you might as well do this and all, right? So this is the first thing, you must do that. Even if it's not in your first plan of action, you must cater to her need. The second thing that she said was कि यहाँ से drooping लग रहा है. It means basically उनको tear trough में issue लग रहा है. Just fixing a tear trough will be good. So if at all she's on a budget and she just wants to do little things first, you just do the masseter for her and tear trough correction, and that's all. But then while she said that, you have to now explain, okay ma'am, this is what we are thinking. Okay, that's your concern, but from a little artistic and aesthetic and as a doctor's perspective.
टेंशन से एंजाइटी से कुछ लोग थोड़ा सा एंजाइटी में ना ये लास्ट के जो पीक है वो ऐसे ग्राइंड करते रहते हैं, वेट लिफ्टिंग में, नींद में, कभी भी आपका होता है. जब आप ग्राउंडिंग करते हो तो ये आपकी बहुत ये जो मसल होती है, हमारा बिगेस्ट मसल ऑफ योर फेस, ये बल्क अप हो जाती है, जिसके कारण फेस ब्रॉड लगने लगता है. सो ये इसको चेक करने के लिए यू हैव टू पुट द लास्ट टू टीथ ऑन द टॉप ऑफ ईच अदर एंड जस्ट क्लेंच करो. आप एक बार मेरा फील करो ऐसे, राइट? यू क्लेंच करो. पूरा कर रही हूं मैं. अब अच्छे से लास्ट की टीथ दबाना है. दोबारा करो, जोर से करके रखो. या हां आपकी मैसेजेस हैं, अभी आप अच्छे से नहीं कर रहे हो, मिलता ही हो. बट इसको करने के लिए देयर इज एक मसल रिलैक्सेंट इंजेक्शन होता है, निकोटीन होता है. उसको आप मसल में डाल दो, जस्ट 2-3 ड्रॉप्स डालने होते हैं. ओवर अ पीरियड ऑफ टाइम, वो लाइक 15 to 20 डेज के टाइम में या मैक्सिमम 1 मंथ में नेचुरली आपकी मसल रिलैक्स हो जाती है. मतलब कोई ब्रूज कोई सही कुछ नहीं आता. यू कैन डू इट सिंपली, जस्ट वर्क आउट एंड इट वेरी नेचुरली जस्ट गिव्स यू अ वेरी oval and slim kind of a shape to the face. So that's something we can definitely do for you. It's a very easy thing. But this is one thing that you wanted. जब ये करते हैं, वो सेम ही इंजेक्शन को आप 1 मिनट में देखिए, हल्का सा यहाँ की चिन भी ऊपर जा रही है, जैसे इसको रिलैक्स करने के लिए हल्का सा इसके 1-2 स्पॉट्स यहाँ पे हम करते हैं. और वो सेम ही जो इंजेक्शन है वो यहाँ पे भी यूज होता है, जो आपका इकट्ठा हो रहा है ना स्किन. So इसको बस अच्छे से वेल रेस्टेड और एक स्मूथ सी लुक देने के लिए just few drops here. So this, because it's the same product, we can use the same product to do some little things on your face. But the most important thing that caught my eye when you just walked in was that ये आपका ये droop करे, जिसका फेस थोड़ा सैड लग रहा है. In fact eyes के बाद में नजर नहीं, पहले से लग रहा था फेस की सैड और droopy लग रहा है. So this is the first thing. See, she talked about the structure. That's the first impact when you walk in. And second is the droopy look. So I feel इसको अगर हम ऐसे करें तो फेस ऑटोमेटिकली बहुत अच्छे से स्माइलिंग लगेगा एंड हैप्पी लगेगा. So ये करने के लिए सबसे पहले हमें ये और ये करना जरूरी होता है. जब तक हम ये स्ट्रेच नहीं करेंगे, अंडर आइज आपकी फ्रेश नहीं लगेंगी, और ये लगता है कि प्रॉपर बॉर्डर नहीं है, डेफिनेशन नहीं है. So what we can do is we can just define your lips in a way that it looks nice. I mean, you get a proper definition which you may be having few years before and you've lost it now. So और plus थोड़ा सा lips को जब definition देते हैं ना तो ये सिर्फ फैले नहीं लगते हैं. It just looks very nice, lifted kind of a thing. So this is a very soft lip enhancement that we can be doing as a third, I mean as a
this is something you should always show it to the patient that ma'am, we are using opening a fresh product for you, and this is the lifting product from a very leading company in the world. So you open, this is almost like we would have done with previous fillers as well. So take off the cork and you just need to put in the needle and just make sure that you prime it. Prime as in you have to do, just make sure that the filler is already there in the pebble, and please make sure that you tighten it up in a way that it's not loose, because if you just put it, the filler can just come out like that. So that's it. So you have 2 needles with every product, and when we get started, please come back now. So the first thing that we are doing is we are definitely creating a support on around the cheek area, right? So with this, as I told you, you have to just see the zygomatic arch, right? या तो आप यहाँ side पे करते हो. I mean, I always feel you should. People like their face to be more compact and chiseled, right? Rather than creating wide cheekbones. So this is the zygomatic arch that I'm feeling, the lateral side of it. So you just see the first point, we always take outer canthus, like a line drawn from outer canthus down to the zygomatic arch. This is the first point that gives the height of the cheeks. Then 1 centimeter lateral, 1 centimeter lateral. This is one point we can do. And then another point is, like, if you see her tear trough is like half moon shaped cavity, but this little sag around here, if you give a little support around this part of the tear trough, this just adds, this is called apple of the cheek. Not only adds a soft plumpness to the cheek here, but also gives a nice support to the tear trough as well. And then of course with the tear trough, once you stretch this, see the trough is already looking better. And then this is a, ma'am, you'll have to open the eye, look up at the ceiling. You can keep blinking, no problem. Do you see this lateral lid cheek junction? This is what I was talking to you about, because most people end up filling this, but ye nahi hota. So if you do this, this is like entire cavity. This also gives a very nice feathered out look, blended look. So this and her tear trough, these kind of, just blend this entire area. Once you have done that, then we go ahead with the marionette lines. So if you scrunch the tissue, see the volume is spanning all the way here, from here to this area. So actually, if at all you see that her chin is also just buckling up, you need to be relaxing. But ye volume deficiency ke karan her chin, the lower third of the face, is also looking small, shorter. So when you just build up the volume here na, isko jab thoda sa bhi volumize karoge, she'll start developing a little stretch and lengthening of her chin. So this is what you need to be doing. So I hope you understood that what is the area we need to target. Now with this, you do one bolus here, deep down, 0.2 ml. Another bolus you can do, I think you can do a little thing here, just to kind of give that stretch and that filled out thing. And another you can do here, right? So otherwise, because the reason I'm not saying, because many people have deficiency in crease building in the center, but inke case mein nahi hai. Inke case mein just follow the crease. If I, sorry, just remove it. You see the crease showing up here, so you do here. And then you also know that the crease is going all the way here, isliye you do here, right? And then of course, ye wala crease to hai hi here. So you need to just do a linear threading here, right? We do this, and we only do this after we have like nicely stretched the face from here. Okay.
Do volume for this as well, though you can do universal as well. I think let's just do universal. Let's not go with how I would want. Let's just do volume here. We can also do the volume on the cheek as well. And universal here and universal here. Let's just stick to that, because universal is indicated for nasolabial and mentolabial folds, and also for the tear trough soft correction. Okay?
So the first thing is always ask the patient, just a slight side, ma'am, make a V from your fingers, and that's how you just stretch the face. You'll have a good, nice, ample stretch. So 1, 2, 3. 3 points we did, right? So I will start from the outermost point first. Just relax, ma'am. Relax, relax, relax. Okay. Sometimes the point you marked, see, I don't feel the bone here. So don't worry. This is where I'm feeling, right? So I'm just giving. So you've seen iska, I don't know, I wanted to show you the devil. Sorry. Do you see 1.2? So I'm planning to do 0.2. Gauze thinner, Saurabh. Are you okay?
You're planning to do?
0.2.
0.2. Yeah. I can hold this with the tip of your little finger. 1 centimeter ahead. I'm on the bone. 0.1 here and just 0.1 ahead. It's always good to go softer in the first go. So it's just the outermost point needs a little more bulk for a nice stretch and lift. Aage, as you keep going ahead, just do 0.1. You can even do 0.1, 0.15. So these are 3 standard points. Now there have been lot of cases where agar aapko lift acha chahiye, I mean you can always do points in between these points. You can even go a little ahead of that. Let's say I just want a little lift. Just relax, relax, relax. After this point, because the needle goes blunt, we can just change the needle as well. These points, and you can even do, agar kisi ka wide zygomatic arch, you can even do down here. Like together, this complex will create a beautiful lift then. So
with the lateral thing, you see the hooding here. So we just start from here. So again, just a little stretch. I'm starting from here. So you see the angle of the needle. So I go deep and then I'm just making, so I'm going deep and then I'm making it almost parallel to the skin. So I'm actually, आप थोड़ा सा angle दो मुझे तभी I'll be able to do. I'm quite deep. If I lift up, this is how I can just. So I'm just doing a little linear retrograde thing. Just a little bolus, little bolus. Let's see. I'm doing a little around the tear trough area. So here, now as you are going on the inner side of the eye, now you need to be aspirating. See, I'm going deeper, 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 lifting it up here, holding it, and then just very gently aspirate, aspirate. Maintaining the aspiration for a few seconds. It's done and I am injecting. I just injected a bolus. Now I will just be massaging it towards the inner side. Sorry, ma'am. And just one last thing you do here. Enter from here. Relax, relax, relax. You're almost close to the inner canthus. With my hand, I'm just giving a little stretch to the tissue. Holding it. Little aspiration. Make sure your needle doesn't go down, right? Because you will end up creating a very unnatural volume there. Okay, aspiration done. Okay, I just did 0.1 here and then I'm coming out. Niche na jaye, okay? And then you can just massage with one hand or just make sure that you are just ऐसे massaging. Because ये बहुत ज़्यादा hydration करके इतना puffy नहीं होता है. You can always under correct the eye also. And right now, if at all you feel थोड़ा lumpy bumpy because of the needle pricks and all here, it just blends in naturally in like 48 hours or so. Let's just एक बार have a distant look. If I need to massage, mold, do anything, then we can just have a look. Can I just area? Okay, just in a very micro drop, just to pressing, blending. Okay, एक बार please sit up. Let's have a look. I'm going perpendicular, like right straight from here. Superficial only, up to the corner of her mouth, right?
Okay.
And this is where I do a bolus. This is just to give a support to the corner of the mouth. Gauze. Open the mouth. Sorry, 1, 2. Close it, please. feeling better? ये हल्का सा impression if at all we have. ये this tip, just I'm touching the tip of the needle, just touching perpendicular, and I'm just leaving a bolus. That's it.
You just, patient is stubborn, you are stubborn, you don't want to do a thread lift, then you do again cannula se either you do this kind of a you do a volume filler on the lower part of the zygomatic arch so that it gives this stretch and support from here. So yeah, I mean cannula se यहाँ से या जैसे mid cheek का cannula करते हो, और zygomatic arch, if you feel इनकी zygomatic arch is like broad, you can even do points on the lower side wherever we've done, and by stretching it just do some series of points here. That can also give a nice support and a thing. So ये देखो ये कितना stressful appearance लग रहा है ना all the time she's, so you must just relax this, and this is just on the spot what we are seeing. Once it hydrates and integrates, so it definitely will come out much better. Do you see some difference in the corner of her lips?
Yes ma'am, yes ma'am.
It's definitely looking more uplifted compared to the entire curve that she was having. And also another positive thing that has happened, ये जो इतना फैला हुआ था, this entire line, this is also looking a little more constricted. So yeah, the whole thing is about the technique. Once you are doing, बात कर रहे हो ये कैसा लग रहा है, face down भी लग रहा है, ये थोड़ा slim भी लग रहा है, lifted भी लग रहा है.
Right.
Even under eyes यहाँ देखो ये गड्ढा यहाँ से यहाँ तक है, ये fresh लग रहा है. So ये जो भी result है, this is like maybe 50 to 70% result. 50 to 70% result. You have to consciously drink more water for the next 2-3 days. तो ये जो भी हमने डाला है supplement, ये water को absorb करके further lift करता है. So your face will start looking even more nicer than better.
अच्छा ये जो unevenness है eyes के नीचे,
ये that will settle down just because of injection marks and all ना, वो थोड़ा bumpy हो जाते हैं. You're supposed to apply the cream that I'll be writing you down. Do it for 2-3 days and then this will settle down. See when I'm looking you from here, यहाँ से बहुत अच्छा side cheek contour आ रहा है.
much better than
even than this side. Even your lip का corner is looking much better here. But as you mentioned, like for your इसको relax करने के लिए and further थोड़ा सा odd lift देने के लिए we can do something else also, which we can discuss later. I mean अभी today we'll just finish this. Just see, her face is looking broad here and very drooped down, and here it's just looking more lifted up as well, and the eyes are looking fresher, lip corners too. But if you just see it like this, ma'am थोड़ा सा chin down करो, eyes ऊपर देखो. How are you feeling? एक second. I think I should just take her. So in a side profile, you see the tear trough. See the tear trough there. You see the height of the cheek building up, and here the cheeks are looking very flat and drop down. See the fold, how it was, and see the jowling here. And also there was a little bit of a pre-jowl sulcus if at all you feel. And also the finer intricacy, if you want to look, the chin is looking very buckled up here, and here यहाँ पे थोड़ा सा open लग रही है ना.
Yeah.
So once you do a little bit of a toxin, it will just further open up. So I think this is really giving a good picture of the on-the-spot side profile result. When we are looking at her side profile, so when I'm looking at her front view like that, here the face is looking very flat because the face is looking very square because the cheeks were also dropping down, and here don't you feel the squareness of the face is also looking better because we've given more ovalness to the face. So, and this droop, her under eye, overall I think if her forehead lines look more well rested na, her eyes ka jo ye tired sa look will look much better. Yeah. So the tissue just needs to hydrate and look a little better. I think ye wala line karna tha, but anyways we'll do it later. So once it hydrates and it looks better,
सो बेसिकली हाफ एरिया मैम ने किया था, हाफ एरिया हमने किया पेशेंट को फिलर्स. इट वाज रियली नाइस एक्सपीरियंस. ऑल्दो मैं पहले भी ऑलरेडी करती हूँ फिलर्स, बाकी लेक्चर्स भी लेती हूँ फिलर्स के, बट हमेशा किसी नए डॉक्टर से आपको मिलना चाहिए. अगर ऐसे कोई वर्कशॉप मिल रही है तो करनी चाहिए. रीज़न बीइंग डिफरेंट डॉक्टर्स के डिफरेंट टेक्निक्स होते हैं। फॉर एग्ज़ाम्पल मैं यूजुअली आइज़ में कैनुला टेक्निक से करती थी हमेशा, लेकिन यहाँ पे मैम इंजेक्शन से कर रहे थे, बता रहे थे। एंड मुझे हमेशा लगता था इंजेक्शन टेक्निक बहुत हार्ड होती होगी या ट्रॉमा के बहुत ज़्यादा चांसेस होते होंगे, बट करने के बाद फील हुआ कि नहीं, इतना ज़्यादा मुश्किल नहीं है, वन कैन डू इट। तो बेसिकली कभी भी एज डॉक्टर आपको ओवर कॉन्फिडेंट कभी नहीं होना चाहिए, बिकॉज जितने नए नए डॉक्टर्स आपको मिलेंगे, नई नई चीज़ें सीखने को मिलती है। एंड आफ्टर सीइंग एवरीथिंग मेरा खुद का मन हो गया कि चिन फिलर करा लेती हूँ। बहुत ज़्यादा नहीं, बट मेरी चिन थोड़ी छोटी है, तो मैंने सोचा था हल्का सा प्रोजेक्शन हो जाएगा। एंड बिकॉज मुझे बहुत अच्छा भी लगा, फिलर भी बहुत अच्छा है। तो स्पेशली अगर एज डॉक्टर मैं कोई चीज़ करा रही हूँ तो मुझे उस प्रोडक्ट पे कितना ज़्यादा ट्रस्ट है, तभी मैं करा रही हूँ।
नहीं लगा था,
अगर आपको भी कराना हो
एंड मुझे
तो
बिल्कुल
आप
पेन नहीं हो रहा था।
अदरवाइज मेरा पेन थ्रेशोल्ड तो बहुत कम है,
वंडरफुल रिजल्ट्स देते हैं,
बट क्योंकि फिलर के अंदर ऑलरेडी रिजल्ट आता है।
फॉर एग्जांपल आप
होता है
यहाँ पे चिन
तो
फिलर हो
उस
रहा है।
हिसाब से जब मैं कर रही थी तो कोई मेजर पेन नहीं हुआ, कोई ज़्यादा तकलीफ नहीं हुई मुझे, आराम से मैं करवा पाई। फिलर्स चीक पे, चिन पे, अंडर आइज, टेम्पल एरिया, मल्टीपल एरियाज़ में हो सकते हैं। And here you can see the difference, proper V shape on spot, बहुत ज़बरदस्त। I was so happy. So guys, if you want to book your filler appointment, kindly contact us. Keep watching, do subscribe, take care.